I'm Stephanie Gonzalez, and I am a nurse practitioner student performing a head-to-toe physical examination on Mr. G today. Prior to entering the room, I have washed my hands. Mr. G has emptied his bladder, changed into appropriate attire. His vital signs, including height and weight, were all completed and within normal limits. Cranial nerve number 2, which is the optic nerve, was also assessed using both the Snellen and Rosenbaum charts, and that cranial nerve was intact and his vision was 20/20. On first inspection, I can see that Mr. G is a well-groomed, healthy male patient. He's sitting midline and erect. There's no obvious deviations present. He's alert and oriented. We're going to assess the 3 cranial nerves. We're going to start with cranial nerve number 7, which is the facial nerve. I'm going to have Mr. G squinch his eyes shut, wrinkle his forehead, puff out your cheeks, and smile. So cranial nerve number 7 is intact. We're next going to assess cranial nerve number 5, which is the trigeminal nerve. I'm going to ask Mr. G to please clench your jaws shut. At this point, I'm going to palpate his jaws, and I can see that they're even for tone on each side. I'm also going to ask him to open and close his mouth, and I do not feel any popping or clicking in his TMJ. I'm also going to assess his sensation, his dull, sharp, and soft sensation on his head. So I'm going to ask Mr. J to close his eyes, and I'm going to place an object on your face, and you're going to tell me what sensation you feel.
Sharp, soft, sharp, soft.
Sorry. Next, we're going to assess cranial nerve number 12, which is the hypoglossal nerve. I'm going to have Mr. G stick out his tongue, move it up and down, and side to side. Good. Next, I'm going to palpate his head. I can see that his head is pink and his skin is smooth. There's no obvious lesions or masses. His hair is clean and dry with even distribution. I'm also going to palpate his sinuses. Let me know if you feel any tenderness.
No.
No tenderness present. We're going to move down to his eyes. I can see that his eyes are symmetric bilaterally with even hair distribution on the eyebrows and eyelashes. His sclera is white. We're going to assess his conjunctiva, which are pink and free of erythema or exudate. I'm going to palpate his lacrimal apparatus, which I do not feel any masses or drainage present. Did you feel any tenderness?
No.
Okay, good. So while assessing the eyes, we're going to check for cranial nerves number 3, 4, and 6, which are the ocular motor, trochlear, and abducens. We're going to do this by checking his pupil reactions and his vision fields. I'm first going to do the pupil reaction with the light. Look straight ahead for me. So his pupils are round reactive to light and accommodation. I'm also going to ask Mr. G to follow my finger in the 6 cardinal fields. Okay, good. And we're going to check for peripheral vision. Just hold one card up. And let me know when you see my fingers.
No. No. No.
And the other side?
No.
Okay. I'm also going to have you focus on an object in front of us, and I'm going to check for strabismus to see, and I'm going to cover one eye, and if the other eye does not accommodate for the covered eye, he will be negative for strabismus. And he is negative for strabismus. We're next going to go down to his ears. I'm going to assess them and inspect them. I can see that they are symmetric bilaterally. They're even with the inner canthus of his eyes. I'm going to palpate them. They are soft and pink with no masses or skin tags present. Was there any tenderness upon palpation?
No.
No? Okay, good. I'm going to assess cranial nerve number 8, the acoustic nerve. I'm going to do this by doing the whisper test and the Rennie and Weber tests. The whisper test, I'm going to stand behind Mr. G and he is going to repeat 3 words that I whisper to him.
1, 2, 3.
Okay, and I'm going to try the other side.
ABC.
Okay, so good. Now we're going to do the Weber and Rennie test. I do not have a tuning fork for this examination, so we're going to pretend using a reflex hammer. For the Weber test, I'm going to activate the tuning fork and place it on the top of his head, and he's going to let me know if he can hear the vibration on both sides equally. We'll do this like this.
Yes.
Okay. For the Rennie, I'm going to check for bone and air conduction. I'm going to again activate the tuning fork, place it on his mastoid bone, and he's going to tell me when he doesn't hear the noise anymore.
Now.
And I'm going to place it next to his ear. Just let me know when you don't hear that anymore.
Now.
Okay, good. So air conduction was 2 times longer than the bone conduction. I'm going to inspect his nose. His nose is midline and there's no obvious deviations. His nares are oval and symmetric. I'm going to palpate his bridge and the soft tissues. No tenderness or masses present. I'm going to ask him to occlude one side, please. Take a deep breath in and do the other side. And I can see that both nares are patent. We're also going to assess cranial nerve, number 1, which is the olfactory nerve for the sense of smell. I'm going to use 2 different smells and ask Mr. G to close his eyes, and I'm going to see if he can detect which smell I'm giving him. So go ahead and close your eyes. Take a deep breath. And what was that?
Vanilla.
Very good. Next. Do it again.
Sherry.
Okay, very good. So cranial nerve number 1 is intact. I'm also going to inspect using the light his mucous membranes in his septum and his turbinates and his nose. Please place your head back. Alright, mucous membranes are pink with no erythema or exudate. The septum and turbinates are also intact. Next, we're going to move down to the mouth. During this assessment, I can see that his mouth is symmetric. There's no obvious drooping. His lips are pink and moist and dry. There's no cracking or chapping of his lips. I'm going to put my gloves on now, and I'm going to assess the inside of his mouth. Go ahead and open your mouth for me, and I can see that his teeth are clean with good oral hygiene. He's not missing any teeth. There's none loose or chipped. There's no halitosis present. I'm going to palpate his gums, and I can see that his mucous membranes are pink and moist and no abscesses. Can you please stick out your tongue? His tongue is soft, no abscesses, pink and moist. I'm going to check his uvula at this time. Please stick out your tongue. Say ah.
Ah.
Okay, I can see that his uvula is midline with normal rise. At that time, I would also be checking for cranial nerve number 10, which is for the gag reflex, and cranial nerve number 9, which would assess for bitter and sour taste. But we are not going to do that at this time. Moving down, I'm going to assess Mr. G's neck. I can see that it's midline and it has no obvious masses or goiters present. I'm going to palpate his trachea and his thyroid. I can see that his trachea is midline and soft. Go ahead and swallow for me. Okay, and there's no masses or goiter present in the thyroid. I'm going to listen with the bell on my stethoscope to his carotid arteries. And there were no bruits present. I'm also going to check his range of motion in his neck. I'm going to ask him to touch his chin to his chest. Lean your head back and side to side. I'm also going to check your strength in your shoulders. I'm going to push resistance against your shoulders if you can just shrug your shoulders. Okay, good. So his strength is even on both sides. At this point, I'm going to palpate his lymph nodes. And we have pre-auricle and post-auricle and occipital, anterior and posterior superficial cervical chains, submandibular, tonsillar, and submental. And there is no lymph node enlargement or masses present. Next, we're going to ask Mr. G to take off his shirt, and I'm going to assess his chest and his back. I'll take that. You want to face the wall. Upon inspection of his back, I can see that the skin is smooth and clean. There's no scarring or deviations or suspicious nevi or moles present. His shoulders are even bilaterally. I'm going to palpate his back. It's warm to touch, and I'm going to also palpate his spine, and I can see that it is midline. There's no curvature. At this point, I'm going to listen to his lung sounds, followed by percussion. Go ahead and take a deep breath. Like that. All right. You're in here still? Okay, good. So his breath sounds posteriorly are clear bilaterally. I'm also going to assess for tactile fragmentus. I'm going to start at the top and work my way down while Mr. G repeats 99.
99, 99, 99.
Okay, good. And I'm also going to check for lung expansion using my thumbs in the 10th level of 10th rib. And my thumbs are touching at the level of his spine. So go ahead and take a deep breath. There we go. And he does have even lung expansion on both sides. At this point, I'm going to percuss his back, starting from one side and going side to side. I'm going to listen for normal tympany and make sure there's no hyperresonance or dullness present. Good. So we have normal tympany, no hyperresonance or dullness present. I'm going to ask Mr. G to please cross his arms. At this time, I'm going to check for diaphragmatic excursion. I'm going to start at the top and percuss down till I go from dullness to tympany. Oh, pen. Go ahead and take a couple deep breaths and breathe normally. And then next time you take a deep breath, I want you to exhale and hold it. Exhale and hold it there. Okay, I'm going to do it again. Okay. Grab my and the diaphragmatic excursion should be between 3 and 6 centimeters, and his is 3 centimeters. Thank you. Go ahead and turn back around, please. Looking at the chest, first I'm going to inspect it. I can see again that it has even tone. There's no signs of respiratory distress or use of accessory muscles during breathing. I'm going to listen to his lung sounds anteriorly. Go ahead and take a deep breath. Lift your arm up for me, please. And the other arm. So again, his lungs are clear bilaterally. I'm also, while I'm in this area, I'm going to also palpate his clavicular lymph nodes and his axillary lymph nodes. Okay, and Under your arm, please. And both areas are free of any nodules or swelling of lymph nodes. Next, I'm going to listen to his heart. Using the bell of my stethoscope, I'm going to listen to the different areas of his heart, starting at the aortic. Then the pulmonic. And then Erb's point. The mitral. And the tricuspid. And his heart rate is a regular rhythm and no murmurs present. I'm also going to palpate his heart for any thrills or heaves. I'm going to start at the apex, right under the left breast. Move over to the left sternal border and move up to the base. And there are no thrills or heaves present. At this time, I would also want to percuss his cardiac border. I would start at the anterior axillary line and move my way over to the sternal border, going from tympani to dullness, the dullness being his cardiac silhouette. Okay, great. So go ahead and lay down. At this time, I'm going to assess his abdomen. I can see that his abdomen is flat and well-toned, has even color and skin distribution. Again, no signs of distress, no scarring, or no obvious suspicious nevi or moles. I'm going to listen to his bowel sounds times all 4 quadrants. And bowel sounds were positive in all 4 quadrants. I'm also going to use the bell of my stethoscope to listen to the abdominal arteries, including the aortic, the renal, the iliac, and the femoral arteries. We're going to start with the aorta. Move to the renal. Then the iliac. And then the femorals. Okay, good. And again, all are present. There are no bruits heard upon auscultation. Next, I'm going to percuss and palpate his liver and his spleen. I'm going to start in the area of tympani and move up to an area of dullness over the liver and spleen to assess for the borders, assess for any enlargement. And here is his liver border, and I'm going to palpate. And there is no hepatomegaly present. I'm going to do the same thing on the other side for the spleen. I'm going to palpate his spleen, and again, it is non-palpable and no splenomegaly is present at this time. I'm also going to, while I'm here, see if I can palpate any kidneys. I'm going to use my right hand under his back, use my left hand to palpate. Let me know if you feel any tenderness at those times.
No.
Okay, and they're both non-palpable?
No.
Okay, good. While I have Mr. G laying on his back, I'm going to do the range of motion for his legs. I'm going to have you bend your knee up. We're going to do abduction and adduction. Try the other side. Okay, good. I'm going to have you sit up now. And going back, I did forget to check for his the flank tenderness using the costovertebral angle, which I need to percuss. So I'm going to do that at this time. Let me know if you feel any tenderness or pain when I do this.
No. No.
Okay, good. So he's non-tender on both flanks. We're also going to look at his hands and his feet, his upper extremities. His arms are pink and smooth. No deviations or lesions present. His has even hair distribution. His fingers are warm and pink with no good cap refill, no clubbing or cyanosis present. I'm going to check his radial and brachial pulses. Just relax for me. Okay, and they are 2+ bilaterally. I'm having Mr. G put his arms like this and pull me and push me away and push me. Okay, very good. So he has equal strength in both sides. I'm also going to look at his lower extremities. I also see that they're both pink and warm with even hair distribution. His toes are pink, no clubbing, cyanosis, and good cap refill, and there's no edema present in neither leg. And we already checked his range of motion. We're also going to check his coordination. So I'm going to ask Mr. G to please put his hands on his lap and alternate patting and clapping both sides. And speed up as you do it. Okay, good. I'm also going to have you touch your finger to your nose to my finger. Okay, good. I'm going to ask you if you can take your heel on your left leg, place it on your knee, and your right leg, and slide it all the way down to your foot. Okay, good. And if you could stand up for me, we're going to check the Romberg test. Close your eyes. And there's no swaying present, so he is negative for Romberg. Go ahead and have a seat, and we're going to check your reflexes. First, I'm going to check your brachial reflex. Okay. Just relax for me. Okay. Reflexes in your knee. Okay, and also the tibial reflexes. And all reflexes were intact. That concludes our examination for today. Thank you.